Yeah, go
Friends,
ahead.
good morning, good afternoon, good evening, depending on the time zone you're listening to. I'm Ajay Kumar with GS Lab Gaps Technologies, and our topic of discussion for today is resilient futures, mastering disaster recovery and business continuity planning for health systems. Most of us in the technology industries are known for creating acronyms, and we've been guilty of doing that. So if you hear DR, BCP as we move forward in the discussions, that'll be for disaster recovery and business continuity planning. Let's take a step back. Simply put, what is DRBCP? In an event of disaster, be it created by natural reasons or man-made, how quickly, efficiently, with minimal or zero disruption, can you get your business back up and running and are able to serve your clients? And do you have a robust plan to ensure the business continuity happens? This is where the disaster recovery and business continuity planning kicks in. In this discussion, we're going to be focused more on the cyber resiliency piece, and I'll explain the rationale for it. If you look at today's scenario in healthcare, technology role has become so critical for delivering life-saving services. So, right, leveraging your digital transformation for electronic health records, connected devices, IoT, telemedicine, the list is endless. When you're using those to deliver services, it also opens up for vulnerabilities. Patient data security. Last year, as a data point, in just 9 months, 1 out of 4 persons, their health records were exposed due to cyber attacks. I'll repeat. 9 months into last year, 1 out of 4 persons' health records were exposed to due to cyber attacks. So patient data security, keeping systems operational running, no longer is the role of just the IT team or the CIOs. It is a CEO, CFO, the board level, every employee's responsibility to take this very seriously. And obviously, there are immense amount of financial impacts related to that, where you talk about loss of revenue margins, your expenses go up, your disruptions are there in supply chain, you may be facing litigations and claims. There might be impact on your branding. Uptime Institute says that a medium-sized hospital, just 1 hour of their EHR being down, they lose $1.7 million per hour. But what is most critical from my point of view is that what is at stake when it comes to health system, which separates it from any other vertical, is that human lives are at stake. So when you have loss of access to care, the mortality rates go up, the morbidity rates go up. You also have another interesting angle on mental health impact in the ecosystem. Think of the patients, families, the providers, even the entire healthcare ecosystem, be the pharma company, medtech, payers, all go through immense amount of challenges leading to mental health disbalance as well. And overall, as a community, society, you develop insecurities, fear, loss of trust. All these combined together make our today's topic extremely important and critical. And what is also extremely important for today's discussion is that the panel which we have for today, I'm extremely excited, not only for the experience they bring, but for a simple reason. This has a very holistic kind of an exposure. On one side, we have a CIO of healthcare as a customer mindset. Then we have somebody coming and joining us from a hyperscaler, which brings the product solution mindset. And after that, we have somebody who actually making this all happen as a service provider for healthcare, as to how you bring all these product solutions, how do you understand the customer challenges, and how do you make things happen. So with this, I'm going to move across and look forward to introducing to all of you the esteemed panel we have. So first and foremost, Uday Madasu. Uday is actually a seasoned IT executive with over 20 years of experience in implementing and managing healthcare IT systems. As a key member of the corporate leadership team at Covenant Health, he aligns technology strategies with organizational goals to foster innovation and growth. Previously, Uday served as the CIO for the Jewish Board of Family and Children's Services in New York, and before that, as CIO of River Spring Health. He holds multiple certifications, a dual MBA in Finance and Systems from Ohio and Andhra Universities, and is actively involved in HIMSS and the Guide Dog Foundation for the Blind. Hi, Uday, welcome.
Thank you, Ajay. Glad to be here.
Thank you, Uday. Our second panelist, Sam Gamare. Sam is a seasoned technology executive with over 20 years of experience across global IT delivery solutions. He has led and implemented key initiative rollouts of CCAI, APG, and complex ecosystem and implementation of HashiCorp Vault with DevSecOps across VMs, PCF, and Kubernetes clusters. He's certified across multiple platforms. He has deep expertise in driving enterprise architecture, SOA services, and data center migrations. With a proven track record of delivering secure, high-performance enterprise solutions for Fortune 100 companies, he also specializes in leveraging innovative technologies to simplify complex business processes. He is a true leader in strategic planning and end-to-end solution engineering. And he's here to share his insights into navigating today's rapidly evolving technology landscape and bringing in the hyperscaler mindset. Sam, welcome.
Thank you, Ajay.
All right, moving on to our last panelist, Chandra. Chandra heads the IMS practices, the infrastructure management services practices at GS Lab Gavs, bringing over 25 years of expertise in IT infrastructure, management, enterprise applications, and new product development. Prior to GS Lab Gavs, he served as CTO at Genpact, where he led IP creation and developed the virtual desktop services LeanDesk SM. Chandra holds a patent for a mistake-proofing application and is known for his forward-thinking innovations, such as implementing disk-based backups with SAN replication as early as way back in 2005. A graduate in electronics and communication engineering, Chandra is also a passionate writer, avid cook, and a cricket enthusiast. Chandra, a very warm welcome to you as well.
Thanks, Ajay. Nice meeting all of you.
All right, so let's get kick-started. But before we do that, how about we do a quick poll? And I'll request each and every one of you to see the question across, and if you could post in your response over here. This is just an icebreaker. We want to see how well engaged and how well awake each one of us are here. Uday, Chandra, and Sam, I know these options look very interesting to me. I'm not sure if you guys have any comments onto these, the poll question.
Yes, it's very interesting. I was about to take the survey, but then I read at the bottom that we cannot vote. So,
yeah, we don't want anybody to get biased, but I'd love to hear your responses as well once the poll closes in a few seconds. Uday and Sam, anything from you?
Well, just given where we are in this country at this pivotal milestone, I would probably pick a news app. I am just one of those guys that likes to read the news. So for me, it'll be a news app.
A news app, okay, there we go. Elections around the corner as well, right? Okay.
Yeah.
Yes, Sam.
I'll pick a news app.
Okay.
I do like to be notified of what is happening out there in today's world. So yes, news app is the place I would be.
But I guess you can beat Facebook.
So it looks like we have a fairly balanced response, but social media still takes the lion's share, 38%. Okay. So the audience has spoken.
Those cat videos on TikTok are not, unpopular for a reason.
Okay, with this, let's move on to our discussions. And the way we have structured this conversation today is we look at the why part of it. Why DRBCP? Then we get into some of the challenges, focus areas related to that are there. And then look at what solutions might be there in the market space. And look at what typical challenges, pitfalls, focus areas we need to keep in mind while we're looking at implementing these solutions? So Uday, I'll start with you. As a healthcare CIO, and you and I have had earlier conversations about the immense amount of pressure which the health system face in today's world. What unique challenges do you believe health system face in ensuring business continuity today? And a very high level overview in terms of how are you addressing them today?
Sure, appreciate that. So before I dive into the answers to the question, just as a statistic, according to one study, in the year 2023, the total cost of downtime in the US healthcare market was almost $15 billion. The causes could be ransomware attacks, could be other incidents, but this is a problem with a B. Big problem that all of us have to think about solving. And as you rightly said during your introductory remarks, one of the biggest challenges for healthcare providers who deal with human lives is the disruption on life, right? Sometimes these disruptions could have life-threatening consequences. So the first and foremost focus for us as a healthcare provider is ensuring patient care continuity. Because we know we need to be able to take care of these patients who are coming to us for all kinds of problems. And the way we try to address that is by implementing redundant clinical systems, and focusing on DR is very much an important component of that. The other challenge, especially for healthcare providers, in the last 2 or 3 years is just a rapid increase in the amount of cyber attacks. The healthcare provider market is being targeted by these cyber criminals. So we see more and more incidences of these. So we are constantly thinking, rethinking, evaluating, reevaluating our cybersecurity framework. And what do we do to protect ourselves, protect our patients, protect our staff, protect our services? So that's another challenge. And the way we tackle the challenge is by implementing a very robust cybersecurity framework. The third challenge, very, very critical for many healthcare providers, I think to a certain degree amplified by the pandemic that we all dealt with, is cost constraints. Most healthcare providers in the country don't have deep pockets. They have severely constrained budgets. So we've got to think about prioritizing what we are spending money on. And sometimes we may make a compromise on something like DR, but that's no longer a choice or an option. We've got to pay attention to DR as much as we pay attention to keeping the protection systems up. So we've got to figure out how to tackle this in spite of constrained resources like our budget. And one way we address that is by partnering with cloud service providers, cloud DR as a service, because we may be able to provide solutions at maybe a cost-effective manner. And then the last challenge is just our staff. We've heard in this country about healthcare clinician burnout, and that's real, and we deal with it every single day. So anything else we ask these staff who are already overwhelmed, overburdened to do, that's just one more thing that they have to worry about. So when we introduce new things, whether they are for cybersecurity, whether they're for disaster recovery, we've got to balance how we do that, how we train them to do that without making it even more burdensome. And so those are the challenges, but it takes a lot of planning, coordination, collaboration, communication to be able to put in strategies to tackle all of these challenges.
Thank you, Uday. Some of the stuff which you're talking actually caught my attention. You talked about dichotomy, which said that you guys have so much of pressure in the health system on cost, which is there. And then to make these things happen, you need to find the dollars which are there and make those investments because human lives are at stake. And then you used a phrase, and this is a very close phrase which we also use in our ecosystem quite a lot, and I hear it from my boss quite a lot, is that you may be having these challenges and you use the phrase saying, in spite of that, how do you make it happen? Now, that is something which is so critical, and you have to ensure that the business keeps running. Your patients are getting uninterrupted services, which is so critical. Now, we'll touch base on a little bit more onto this as we move along, but in a hypothetical scenario, in case to ensure, let's say, minimal disruptions, something were to happen for patient care, during these events, in case something hypothetically has happened, what do you need to do? What do you need to undertake to ensure that disruption is minimized or zero disruption?
So, obviously the first step is assess risk. We've got to really understand the scope and impact of these types of events, whether it is a cybersecurity influenced event or, sometimes we could deal with just environmental disasters, or we could deal with accidental man-made disasters, right? Somebody is digging up a street down the line and they don't realize they cut the fiber connection coming into the hospital, and now suddenly the hospital doesn't have network connectivity. These things happen. What we've got to do really is have a plan, and the plan is multifold. The plan is, bringing in all of the partners and stakeholders, and sometimes people don't have these plans in place. And if they have a plan, they're not constantly reevaluating, updating, and practicing the plan. For me, that's step number one. Really be intentional about creating a assessment, business impact analysis, and make sure that you have a plan. And then, really figure out who are all the stakeholders that have to come to the table to help you execute the plan, and practice a plan. Test, and test again.
Got you. So you talked about having plan is not only important, it has to be comprehensive. And then you said regularly you need to keep updating, because every now and then new things are coming across. And so you have to keep that in real time basis. Very interesting. Very interesting. Uday will come and revisit some of the points which you said. But let's move on, and I'll move to Sam. Sam, you heard from Uday. You heard of the challenges strategies. I know in Google, there's a huge focus on DRBCP as well as on the healthcare as a vertical. So if you could spend a little bit of time on talking about the cloud, how important is the cloud in the DRBCP strategy, which is there? And
Sure.
maybe a little bit on the healthcare focus, which you have. That might be very helpful.
Yeah. So I think today's enterprises, right, when they look at their backup and DR strategy, so one of the things that they need to look at is in terms of the value that each of their systems brings to the table, and make sure their strategy for DRBCP reflects that, meaning the high priority systems need to be backed up with that level of diligence versus the lower priority systems and so on. And then it is very important that, I think Uday pointed out to it, is regular rehearsal of how this process effectively works. Make sure it's tested, make sure it actually thoroughly works. And in the case of healthcare organizations, like Uday pointed out, it gets very critical, right? You can't have a hospital going out of touch with their systems, because that causes grief, to not just grief, but it can be potentially human lives at risk, right? So let's take a step back on the Google side of the house, right? Google supports healthcare from several different angles. So Google's healthcare solutions actually span all the way from the DRBCP solutions, what we call GCBDR on our side, all the way down to specific healthcare solutions to Google Cloud Healthcare Data Engine, which is based off Gen AI with MedLM. So Google has a whole slew of tools that are very focused on the healthcare side of the equation.
Thank you, Sam. And there's so much of focus from Google Cloud also in terms of addressing the data security and patient privacy, which is so critical. You'd like to spend a couple of minutes on that as well?
Yeah. So I think this is more than a couple of minutes, but let's try to compress it, right? So Google Cloud brings a whole slew of cohesive tools and controls that really enable your journey towards transformation with reliability and scale, right? And every organization, including healthcare, needs that. And Google Cloud addresses data security at multiple levels, right? So right from supporting encryption for data at rest, data in transit, encryption of storage, for example, with managed keys or customer managed keys. There are strong tools like Mandiant, Chronicle, and even the good old firewall and VPC setup are excellent controls that are offered right from the get-go in this equation. From a data privacy and PII, there is quite a few choices again. So what we have is the cloud data loss protection that actually can make sure that none of the PII data actually gets written to the logs, for example. So there is a whole slew of tools that can actually offer this. Then the cloud healthcare API is a fully compliant managed service that can be used for ingesting, transforming, and storing healthcare data in several formats like FHIR, HL7v2, DICOM format, and so on. And all this can be handled at petabyte scale. No issues, right? Now, Google's GCBDR solution is offered for native Google Cloud, meaning if you are completely on Google, then that's something to use. If you have a heterogeneous and a legacy environments, which a lot of enterprises do, then there are third-party tools that plug in very nicely into this equation to form a cohesive solution. And last but not the least, from a compliance standpoint, the compliance with HIPAA, with MARCI in USA, with 2G, 3M in Japan, with HDS in France, and ISO 9001 and 27001, and so on. There's a whole slew of compliance that is offered from Google Cloud. So Google Cloud is there for our customers, for our healthcare customers. We are there to offer several solutions. What we do promote, along with all this, is the operational efficiency and the cost optimization process and tools that need to be very intelligently embedded in your day-to-day processes so that your spend is commensurate with your risk and you can control your outcomes.
Thank you for that. And what you said towards the end is so critical. And to the earlier point, which Uday was talking about, that the budget constraints typically the healthcare system face today. So when you have these operational efficiencies, and you talked about saying that, how do you ensure that whatever investments you're making are mapping up to the amount of risk you're exposed to, so that their dollars being spent are on the right areas. So thank you for that. This is very helpful. Okay, we'll move on to Chandra. Chandra, you heard from a customer there over here of the challenges, what the customers go through. You heard from a product platform solutions company, the solutions and the focus they have. Now, you as a service provider, what do you do to address the challenges of implementing the DRBCP solutions? And in particular, when you'll go to a lot of these healthcare systems, I'm presuming you come across a mix of a lot of legacy and a lot of modern technology that play. So how do you bring those elements together? If you could throw some light.
Thanks, Ajay, for asking the tough question at the beginning. So, in fact, I've read, of course, all of you also must have read that between the various domains, healthcare, BFSI, manufacturing, healthcare is the one that has been running most of the legacy systems than any other domains. By the way, when you refer to legacy, I think you are referring to the various operating systems, versions, and hypervisor that is running on x86 architecture. Not on the RISC system. The RISC systems like SunSpark or RS6000 or HP9000, I think, except for SunSpark, I don't think anyone else, any cloud service provider is providing any solution. So let us restrict to x86 and the extended x64 architecture. We have plenty of legacies in these areas. We still hear some applications that only run on end-of-life Windows applications because of the dependency it has. On the Unix front, we have plenty of flavors. Apart from the popular Ubuntu, Red Hat, we have the new ones that are coming, Alma, Liberty, and other things. Then hypervisors, we have the very popular VMware, Hyper-V, Nutanix, and KVM. And the database, we still hear Microsoft Access, even though it is restricted to desktops, and we also have Sybase. So there are quite a lot of legacies, and when we work a solution, we need to take care of all of these because no one would like to change the platform because of the DR. So DR is something that everyone expects that it has to come with the least intrusions into their environment. So a workable DR should neither require these legacies to get converted into modern or not ask for more money to get them implemented. It's very easy to put all of these machines, another set of machines in another data center and provide DR, but that's going to cost huge money. So the main challenge actually is how we can provide support for all these legacies. And the main challenge again comes from the hypervisors, not the operating systems or database. So there is a need to have an affordable solution that supports all versions of OS and hypervisors in the environment. So there are solutions available that are OS agnostic, which can support all Windows and Unix, and hypervisor agnostic, all the hypervisors that I said previously. And also they can work on all the cloud service providers. So only thing we need to carefully choose the right one that provides the combinations of the system that are there and the cloud that supports, and we need to go about that.
Got you. So essentially, net, if I'm hearing you, what you're saying is, despite all the challenges which are there, there is a way, a method to the madness to address those challenges and make it happen. Is that fair to say?
Yes, that's correct, Ajay. There are solutions available. It's tough, but then yes, there are available.
Fantastic. Now, this is encouraging to hear. Now, let me ask you, in fact, I have two questions for you now, Chandra. One part is, I wanted to see if you could spend a minute or two on sharing some of the common pitfalls some of the customers, organizations face when implementing the DRBCP strategies and solutions. So that's one part of the question. Second part is alluded to what you were saying earlier in terms of, you were referring to DR solutions being technology agnostic or obsolescence agnostic or skill agnostic. And I'm thinking, is there truly those solutions, can they really be agnostic at all levels? If you could spend a little bit of time onto that also, that'll be very helpful.
So the solutions, yes, actually, if you understand the environment and do the proper assessment, and then we design the solution and implement, yes, we can actually overcome all those challenges that the skills, technology, and obsolescence. You also talked about the challenges that normally one expect in implementing the DR, right? So there are many things that actually that cause the DR to fail. It's not the technology or the obsolescence, or even though they are difficult, but there are many things other than these technology and obsolescence actually that makes the DR to fail. And the first and foremost, and Sam talked about that, Uday also talked about the selection of DR sites. The options available are the secondary data center. Uday also said that it is very easy. That typically we think DR means you put the same systems in another data center or in a colo, but in cloud. But cloud is a new solution. But many think that the cost of hosting a DR at cloud is very expensive, and it is very cheap in on-premises. But actually, the cost of hosting DR at cloud is much cheaper than hosting it in on-premises. This is one challenge everybody has, and they actually take a decision wrongly. Once the DR site is chosen properly, then the identification of the services which one needs to go for DR. Not necessarily all services and applications require this or business critical and require DR. So one should carefully choose what's the one that is really needed when the disaster struck, and choose and go for the DR for that. So this not only reduces the total cost, but it also helps providing enough time for the DR team to focus and plan it better. That's the second one. Third one, after choosing the critical applications, one should know the dependent servers of those applications. So there is something called application discovery and dependency mapping, which actually helps understand the various components of an application. So this is required because if you, out of 6 components of an application, you plan DR only for 4 or 5, then actually it will not help to achieve the full DR when the disaster struck. And most of the organizations do not have this ADDM capability, because of which they don't completely plan for the DR of a critical application. That's the third one. And fourth one is how to make the data available at DR site. So how to copy the data. There are 2 types of synchronization, synchronous and asynchronous replications. And synchronous is good for real-time application, and asynchronous is good for the other non-critical application. But most organizations choose the replication that comes with the application because they've already invested money on that. And they go for the application level replication, which is actually complex, and it does not guarantee 100% data availability when the DR strikes. So that's the fourth mistake many organizations do when it comes to selecting the replication. And fifth one is interesting, the bandwidth. Most of the time, we take the bandwidth for granted. The bandwidth required to copy the data primary to secondary. The reason is actually the one that decides the bandwidth, the rate of change of data. And the rate of change of data is something hard to measure and normally not measured. So people take a gut rule and then they just go for it. But this is another area where the mistakes happen. Even if you have a perfect setup, but if the bandwidth is not there and the data is not replicated, you cannot execute the DR. The last one, I know I have taken more time, but the last one, very important, the DR team and very clear DR team and with the clear roles and responsibilities. A DR team should minimum consist of a DR leader who actually provides instructions, takes decisions, and the damage assessment team, which actually assess the damage and then provide the inputs to the DR leader, whether we should go for a DR or not. Then the crisis management team, who actually manages the customers, stakeholders, and others. Then operations recovery team, typically IT team, which actually executes the DR plan. But what happened again, most organizations do not have this team. So when the disaster strikes, they actually don't know what to do, and they take more time than what they should have actually taken to recover the systems.
So Chandra, thank you. A very holistic response. It covered your people, process, technologies, which we all keep talking about. And one thing I may revisit depending on how much time we have towards the end of the discussion was that you talked about a misconception in the people's mind about that on-prem DRs might be cheaper than the cloud, and which you said strongly no. And that's a misconception. So why does that happen and some of the stuff, but we'll see if we have more time toward the end of the webinar to come and probe that. But thank you. Thanks a lot. Let's change gears a little bit. Let's look at how technology has evolved and what is the impact it has created for the solutions, what used to be available earlier, what are available today, and what might be there in future. So this question is open to all the panelists, actually. In what ways do you think that tech evolution has impacted your approach to disaster recovery over the last few years? And how do you see the future lying ahead from here?
Yeah, that's a
Open
great
to
question.
everyone.
Yep. So I'll go first, Ajay. It's a great question. And at least for the healthcare delivery system in this country, we've been digitizing healthcare for about the last 20 years. We've had many opportunities to do some very interesting things like using technology in the way we deliver care. So clearly, this has changed the way we think about how we deliver care and therefore how we think about delivering that care in a continuous manner, even when we have disruptions. So I'll talk about a couple of things. So one big one, which especially took off like a rocket, in the midst of the pandemic, was telehealth. And we leverage telehealth as an important aspect of our healthcare delivery, because if you set up the delivery of care using telehealth, then you can truly deliver it in a very different way, right? All of our patients don't necessarily have to come to our community hospitals to be able to consume care. We can many times very effectively deliver care at home, in the community setting. So telehealth, I think, has made life very easy, both for providers and for clients to be able to have continuity of care. So that's a big one. The other big one for us is just unified communications. I mean, we have some very interesting tools. For example, we grew up with things like Xerox, as a even though it's a brand, we incorporated it into language. So my mom, who lives in India, often tells me, why don't you Zoom me? It's just a matter of fact that we are using Zoom today, but these unified communication platforms have really revolutionized the way we can collaborate not only internally amongst ourselves, meaning amongst our clinical, non-clinical staff, but also with our patients, right? We've leveraged Teams, Zoom, other unified communication platform, and they have been a game changer. So we have unified communication platforms that we leverage even if the rest of our critical infrastructure is not working, because we are using some cloud-based platforms that are constantly going to be available to us, right? So those have been a huge game changer for us. Last but not the least is cloud computing. Many of us traditionally always wanted to run our applications on-prem. Many hospitals have data centers in the basement where everything ran in the hospital. That's no longer the case. Many of us were a little apprehensive, skeptical moving into the cloud. But I think now we are cloud first focused, cloud enabled. Electronic health record systems are running in the cloud. Human capital management systems are running in the cloud. So I think cloud computing has definitely changed the way we are leveraging technology, digitizing healthcare so that we can provide care. So for me as a provider, those are some things that I think, have come to bear in a great way that allow us to do what we do for our communities.
Fantastic. And Uday, I just summarize whatever I heard from you. You talked about three key things, right? You talked about telehealth, you talked about unified communication platforms, and you talked about cloud computing. So those three areas which you believe are the most impacted technology-wise, which you believe in the healthcare system. Fantastic. Thank you. Sam or Chandra, please feel free to add.
I would love to jump in here and really echo what I heard from Uday as well, right? So yes, the world is changing and the cloud is making a dent. And the architect in me always wants to think about a right architecture that alleviates the need for a backup and recovery as much as possible. So fundamentally, your systems, the way you designed it on the cloud, for example, you would have your implementations in active across regions. So outage on one region should not completely take down your application because you have presence in multiple regions, right? But it takes a lot of effort to put that kind of architecture together. And usually that applies to the newer applications that are designed with active cloud first mentality. Now, the reality is you still have a whole bunch of older applications that you have to support. So that's where you do need your backup and recovery in place because that's something you cannot turn your eye away from, right? And on the cloud, though, do remember that a lot of the backup automation is already, it comes packaged right out of the box, if you will. So, for example, on Google Cloud, whether you're looking to use Compute Engine or GKE or Cloud SQL natively, backups are available right there and there. You don't have to do something out of band, and it's natively supported. Now, you could still have like Chandra was pointing out earlier, you can have application level backups, and you can use additional tools like Terraform, Ansible, Chef, and so many others to really synchronize that from an application ecosystem. But this entire ecosystem, the cloud is definitely making a dent on how you do backups and where you store them and the resiliency of how you can recover. Because if one side's down, you can easily recover in another one seamlessly. If you, again, depending on how your strategy is laid out, your customers may never feel that there was an outage, because that is a very key statement here. Your real backup and DR, you might be recovering behind the scenes, but if your customers don't notice it, thumbs up.
Got you. Now, before Chandra, you respond, just to follow through, Sam, what you're saying, as a layman, I'm going to ask you a question. You talked about, and I know you're a senior architect, and you said the architect within you always wants to think when you're architecting the solution applications, keep in mind these parameters which are there. Now, if I wear the shoes of, let's say, Uday or any of the CXOs, when you look at their environment, you'll have pre-existing applications which are there. So when you talked about thinking of it in architecture level, are you talking only about new, or you're also talking about existing, something could be done about it?
Absolutely. So the existing legacy applications is what I like to call it, because they were not designed with cloud first mentality. We have to be able to support them gracefully, right? And the traditional mechanisms of doing a backup and recovery on site work great until that entire site disappears for whatever reason, right? So there, the choice to have a backup on the cloud with potentially a recovery path that's recovering into the cloud might be a faster way to business continuity as well. So that's where I see the newer age going towards. So for example, if you have a complex legacy application on-prem, you might be doing backup to the cloud, but let's say the site goes down for whatever reason, whether it's a power outage, whether it's flood, whatever. If you have the right strategy in place, you might be able to recover the whole thing on the cloud and make it work. And if you have a seamless endpoints that are pointing to it, you can easily switch from those pointing to the data center to the cloud.
Gotcha. And if I were to combine what I've been hearing from all three of you earlier, right? Uday talked about the immense cost pressures which are there in health systems. Chandra talked about kind of a misconception that going on cloud is expensive versus being on-prem for DR point of view, which is there. And you talked about earlier saying, how do you bring cost out initiatives by ensuring that the customers' dollars are getting only invested into the right areas mapped to the amount of risk they're exposed to. And I think what you said over here right now, which you responded, is all bringing those elements together as well in a way, which is there. So thank you. Thanks a lot, Sam. Chandra, your views on this?
Yes, Ajay. See, more than technology, I think COVID actually taught us how to embrace DR. The VDA and the proliferation of unified communication network across every home in every town, if not villages, have given enough confidence for the organizations to handle natural disaster. That is one thing that technology did in the last 3-4 years. Then I agree with Uday and Sam that cloud has actually made the DR an affordable initiative. Again, I say it is cheaper than what we normally incur if it is only the data center to data center. More importantly, the good DR planning is not only in how we handle DR during disasters. It should also tell how we prevent disasters. So though we cannot do anything on natural disasters, there is definitely something we can do to prevent cyber disasters, which you also touched at the beginning, and which the cyber disasters are actually we are experiencing more. The persistence with analytical AI, which has been there for the last 6 to 7 years, and the evolution of generative AI last 2.5 years, will actually help us detect such cyber attacks much earlier and then save ourselves. So that is where I think this is the role of AI in the DR.
Very valid point, Chandra. And I know that personally you are so deeply involved in all the generative AI initiatives. And so you're talking about it, and which is so impactful for any organization in terms of how you can proactively detect cyber attacks from coming and save ourselves. So very, very valid points. Okay, before we move on to our next set of questions, time for an interactive poll. How often does your organization conduct disaster recovery and business continuity drills? And I know all the panelists and hosts, we are not allowed to vote. We'll wait for a few seconds, but it'll be very interesting to hear everybody's thoughts on this from the panel as well. And after we see the responses back onto this.
Yeah, at least, so I'll go first just as a healthcare provider. It's like I said before, it's not good enough to just have a plan. You do have to test the plan. Now, the degree to which you test your plan, also you have to be very mindful, because you can't just in the middle of the day pull the plug, so to speak, in a hospital and say,
Right.
hey, we need to have a DR. People are not going to react very kindly. So, but it's an opportunity for us to work collaboratively. This is one of those exercises where it really, really goes way past just being an IT exercise, and you've got to work with clinical staff, administrative staff, operations staff, facilities, and in some cases, you may even have to engage with external partners, right? Could be a local ambulance company, could be the next door neighbor hospital, because you're trying to figure out if you can handle patients in your hospital, could you move them to the hospital that has capacity, working with maybe local emergency services. So it takes a lot, and you really, really do have to conduct drills so that your plan's going to really work when you need it to work.
Gotcha. No, the very valid points, Uday. And I think the poll results are here. What I see over here is 60% of people are saying annually. As a customer, and I'll ask this to Sam and to Uday as well, as to Chandra, would you agree with this? Is annual a good, or the frequency should be much higher?
Annual definitely is, sorry, Sam, annual definitely is not good, but that is actually the most practical response, because I know, as Uday said, it's not very easy to conduct DR drill even once in a quarter. But definitely we need to find ways to how to make it at least once in a quarter.
Gotcha.
I always like to find a silver lining on things. The fact that they said annual is great versus never.
A true optimist, right? So no, I hear it. I hear it.
Yeah.
It does tell that people are thinking about it seriously. Yeah, Uday.
Just the other thing to keep in mind for us is, I think, the answer could have been annual, because even from a regulatory compliance, there are some things that we as healthcare providers that are covered entities have to do annually. HIPAA risk assessment, We have to do it annually, but are we only going to do a cybersecurity risk assessment once every year? Probably not. So that's probably another reason why some people may have said annually at a minimum. Yeah, I am with Sam, cautiously optimistic. Once is better than never, but if you can do it more than once, even better.
Gotcha. And actually, as a follow through to what I just heard from all of you, what also comes to mind is that how do you ensure the seriousness when you do these drills which are there? Because I heard from one of the CXOs I was talking some time back, and he was saying that, you know what, we conduct these drills which are there. However, ensuring that it doesn't happen like the fire drills which happen in buildings at times where people know it's just a fire drill, so we just walk out casually across the building which is there. But understanding, appreciating the amount of seriousness which is behind that. So that's another topic to discuss and put some planning across in terms of when you do your business continuity planning. That might also play a big role.
Yeah, and especially in the healthcare world that are very, very quality and safety minded, right? We're constantly trying to make sure that we are providing care, but that's high quality care, avoiding bad outcomes for our patients. And this is one of those where how do you assess and measure effectiveness of the DR plans? And it is true that what you don't measure, you may not be able to improve. So we do have to measure the efficacy of this. And there are several ways we can do it. I mean, there are some hard metrics that we can use, things like recovery time objective, recovery point objective, system uptime, availability. So there are some SLAs and metrics that we definitely can put into place. But beyond that, I think some of the other measurement is going to happen with regular testing and drills to make sure we keep track of what's working well, what's not working well. Even getting feedback from stakeholders, right? So we agreed, this is not just an IT project or a process. There are many people who need to be involved. So asking them for feedback, what worked well, what didn't work well, what should we do different, better, that in itself is a way to measure the efficacy of this work. And then calculating the financial impact, right? There is a cost of not having DR. The cost could be different for different healthcare providers, depending on what their services are, what markets they serve, what kind of service lines they have. But having some sense of the financial impact of downtime in itself is going to give people some food for thought. And if they're not investing enough, maybe that's a way to convince the leadership to make the investments, right? Because hospital leadership, including board members, are thinking about continuity of care, and assessing the financial impact could actually elicit more investment into this. And last but not the least, this requires a lot of transparency. This should not be a surprise. This is an exercise that has to be crystal clear for everybody, good, bad, or otherwise. So making sure that we are measuring the efficacy, by just being transparent is another way, because we want everybody to be aware of what to do, what not to do, what's going to work, what's not going to work. So those are all the ways that we would know whether our DR plans are actually effective or not.
Very right, very right. Uday, I completely agree with you. And the communication piece which you talked toward the end, I think it's so critical. Sometimes the uncertainty of not knowing how to respond to situations adds such big burden on individuals as well as the organization. So the clarity and transparent communication plays such a critical role. So with you on that. Now, I want to make an announcement. I'm seeing some questions coming across on the Q&A. For everybody who wants us, the panelists, to answer some questions, please post it in the Q&A box over there for yourself. And we'll come to those questions and cover. Uday, one follow-up question for you. You have a service provider.
1 second. Before I go, why don't we let Sam say, I think, Sam, you were going to respond to the previous question.
I saw a hand getting up. Yeah, please go ahead.
Yeah, so I think one thing what I wanted to bring up on the frequency, I mean, optimism apart, but I think sometimes there are real use cases where you really need to find your issues earlier rather than later. So I recollect one customer, they used to have tape backups, and they used to use a third-party hosting to store their backups. Now, ideally, the tapes are supposed to be stored in acceptable temperature-controlled environment, correct? But what happened at this vendor is, as they were doing things, their space ran out and they were now shoving tapes into uncontrolled environment. So what happened to those tapes is obviously not a good story, right? And the faster you find out those holes in your strategy in those third parties, which you may not even think about, you might think, hey, my tapes are safe, and it's great, right? So having a regular check rather than an annual is always a beneficial thing. So you find your problems earlier before